right, let's dive in today, huh? We've got this press release all about iron infusions during pregnancy. Could be a real game changer, for maternal health.
Yeah, pretty interesting stuff.
It's from the Walter and Eliza Hall Institute. They're over in Australia.
Oh, okay.
And it looks like they teamed up with some researchers in Malawi for a big clinical trial.
I see.
So we're going to, take a look at why iron's so important when you're pregnant.
Mm-hmm.
And surprisingly common it is for women to be low on iron.
Right.
And then how just one of these infusions could make a difference for a long time, both for the mom and the baby.
Yeah, that's what's really got people talking. Iron deficiency during pregnancy, it's a global problem, affects so many women. We've known that for a while.
Mm-hmm.
But this trial is pretty exciting. Like, it's suggesting maybe we've got a better way to deal with it than just the usual iron pills.
Yeah, it says here that 37% of pregnant women worldwide have anemia.
Wow.
That's like, 32 million women?
It's a huge number.
Even in Australia, a developed country, it's still 25%.
Yeah.
So, why is being low on iron such a big deal when you're pregnant?
Well, it's more than just feeling tired. It's
Right.
Iron's involved in all sorts of important stuff, especially during pregnancy.
Mm-hmm.
For the mother, having enough iron helps prevent fatigue, and it makes it less likely she'll hemorrhage after birth.
Oh, wow.
Even lowers the chances of a stillbirth.
Really?
Yeah.
What about for the baby, though?
It's just as important for the baby's development. You need iron for the placenta to grow properly.
Right.
So the baby gets all the nutrients it needs. And it's crucial for the baby's brain development, too, and for forming red blood cells.
Oh, so that's where this study comes in. It says a single iron infusion, late in pregnancy, can really bump up those iron levels, more than just taking iron pills even.
Yeah, that's what makes these findings so interesting. They did this trial with 590 pregnant women in Malawi. It's one of the biggest studies we've seen on this. And the fact that they did it in Malawi, it's a resource-poor area. It kind of shows you that giving these iron infusions, it can be done safely and it works.
Right.
Even in places where, healthcare isn't as readily available.
That's a really big deal if you're thinking about doing this on a global scale.
Exactly.
So can you break down, what was different for the women who got the infusions versus the ones who took the tablets?
So the results were pretty clear. Women who had the iron infusion, they had a much lower chance of being anemic at delivery. 46.7% compared to 62.7% in the group taking the iron pills.
Wow, that's a big difference.
It is. And it didn't stop there.
Yeah, that's what I thought was interesting, too. The press release made a point of saying that even after childbirth, the infusion was still helping those moms keep their iron levels up.
Exactly. It's not something you see as much with iron tablets.
Right. They kind of struggle with that, huh?
Yeah. And it really speaks to how this approach could have benefits that last a long time. Having enough iron after giving birth, it's not just about recovering.
Right.
It's about setting moms up to handle all the demands of, being a parent.
Makes sense. So what's next? Where do the researchers go from here?
Well, they're really hoping these findings will push the World Health Organization, the WHO, to update their guidelines for prenatal care. I mean, their goal is to see iron infusions become a routine part of care, especially towards the end of pregnancy.
That's pretty ambitious.
It is. It'll definitely be a challenge to get this implemented all over the world.
Yeah?
But, the potential benefits are huge. You can't just ignore that.
For sure. But, got to think about the potential downsides too, right? I'm curious about the cost, especially if we're talking about a global rollout.
Right. That's a valid point.
Yeah.
The kind of iron they used in this infusion, ferric carboxymaltose, it's more expensive than just using iron pills. That could be a hurdle, for sure, especially in places where resources are limited.
And, it's not just the cost of the medication, right?
No, you're absolutely right. You need people who are trained to give these infusions.
Right.
And you need the facilities to support it.
So scaling this up would take a lot of investment.
Yeah, in terms of training healthcare providers and making sure the facilities are up to par.
But, the Malawi study showed that it can be done, even in tough situations.
Right. It's about, weighing the costs against the potential benefits for all those women and their babies.
Makes sense. Now, to be clear, this study was focused on just one specific type of iron infusion, right?
Yeah.
Are there others out there? And are they all as effective?
That's a great question. So they used ferric carboxymaltose in this trial. But there are other ways to give iron intravenously.
Oh, okay.
They have different properties, though, like how quickly you can administer them and potential side effects.
So it's not a one-size-fits-all kind of thing?
Right. Choosing the best type of iron infusion would depend on the individual.
Yeah.
And, what their clinical situation is.
Okay.
We need more research to really figure out how well all these different iron preparations work during pregnancy and how safe they are.
This is all really interesting, but let's get into the specifics of this Malawi trial, huh? Like, how did they set it up? What were they actually looking at?
Okay, so they used a randomized controlled trial, which is like the gold standard for medical research.
Yeah.
They randomly assign the participants to either get the iron infusion or the iron tablets.
Right, that random assignment is important. So you're comparing apples to apples, right?
Yeah.
But what exactly were they measuring?
Okay, so they were really focused on a few key things. The main one was hemoglobin levels in the mother's blood at delivery.
Hemoglobin, that's the protein in red blood cells, right? Carries oxygen around the body.
Exactly. And if your hemoglobin is low, it's a sign of anemia.
So they were directly looking at how the treatment affected anemia. What else were they tracking?
Iron stores. They check those in the mothers both right after delivery and then postpartum too.
Okay, to get a sense of the long-term effects, right? See if that iron infusion really makes a difference for the mother's overall health.
Right.
Especially postpartum. That's a crucial time. But let's zoom out for a second. If we're thinking about iron infusions becoming, like, standard practice,
Yeah.
what kind of impact could that have on healthcare systems, especially worldwide?
Good question. It would mean some big changes, for sure.
Like we talked about, there's the cost of the medication itself, but then there's also the training for healthcare workers, right?
Yeah, absolutely. And making sure the facilities are equipped to handle it.
So rolling this out effectively, especially in places with limited resources,
Okay.
it's a big undertaking. It takes planning, investment.
No doubt.
But, okay, we've talked a lot about the mothers. What about the babies? Does getting this infusion during pregnancy have any lasting effects on their health?
That's something researchers are still digging into, but early findings are looking pretty good.
Good.
Well, some studies are suggesting that babies born to mothers who had the iron infusions, they tend to have better iron stores at birth and during early infancy, too.
So like a little boost right from the start.
Yeah, exactly. And that boost in iron, it could set off a whole chain of positive effects.
Yeah.
We know iron is super important for a baby's brain, how well they develop cognitively, their overall growth.
Wow. Like giving them a leg up on healthy development. But are there any downsides for the babies? Anything researchers are worried about?
Researchers are always looking at both sides, the risks and the benefits.
Sure.
With any kind of intervention, you've got to keep an eye on those long-term effects.
Right.
So far, the research suggests that these infusions are safe for both mom and baby, but we do need to keep observing, make sure that holds true.
We were talking about long-term effects.
Yeah.
The infusions helped those mothers keep their iron levels up after childbirth. Could that have any impact on future pregnancies?
Oh, that's a good question. And it's one researchers are really interested in.
Yeah.
There's some evidence that suggests if you start a pregnancy with good iron levels, you might have a healthier pregnancy, better birth outcomes later on.
Oh, interesting.
More research is needed, for sure, but it's a really intriguing idea.
So this one intervention could have positive effects that carry over into multiple pregnancies.
It's definitely a possibility worth exploring. It shows how interconnected a woman's health is, throughout her life.
It all ties together. So
Yeah.
What else are scientists looking into when it comes to iron infusions in pregnancy?
Well, one thing they're trying to figure out is the best time to give the infusions.
Oh, okay.
Like, is the third trimester really the sweet spot, or could earlier intervention be even better?
So like fine-tuning the timing to get the most benefit.
Exactly.
What else is on the research agenda?
Another area is looking at combining iron infusions with other things, like maybe nutritional counseling or dietary supplements.
So a more holistic
Yeah.
approach, not just relying on one solution.
Exactly. It's about looking at the whole picture.
Yeah. To make sure both the mother and baby have the best possible outcome. We've talked a lot about the science, but let's not forget the human side of this. How might iron infusions actually change what pregnancy and motherhood are like for women?
Well, for women who struggle with iron deficiency, it could be life-changing. Fatigue during pregnancy, it's incredibly draining. It can affect everything.
Yeah, your ability to work, take care of other kids.
Yeah.
Just enjoy being pregnant.
Absolutely. And for women who have really severe iron deficiency or complications because of anemia, the impact could be even bigger.
Like preventing serious health problems, making sure the delivery is safe and healthy.
Right. It's about empowering women to go through pregnancy and motherhood with energy and strength.
But access to care is key, right? What about women who might not have easy access to health care or face systemic barriers? How do we make sure this intervention, which would be so important, is available to everyone?
That's a crucial point. We need a multifaceted approach to make sure everyone has equal access. Well, we need to advocate for healthcare that's affordable. We need to break down those systemic barriers. And we need to make sure healthcare providers are culturally sensitive, that they understand and respond to the different needs of their patients.
It's about recognizing that healthcare is a right, not a privilege.
Absolutely. And it's about making sure everyone has access to information about iron deficiency, about the treatments that are available, information that's easy to understand.
So women can make informed decisions about their health and advocate for themselves.
Right.
We've gotten a lot of questions from our listeners. Maybe we can take some time to address those now. What are some of the top concerns people have? What are they curious about?
Yeah, those long-term effects on babies. People want to know, does it make a difference for their health and development later on if they get these infusions during pregnancy?
Yeah, a lot of research going on about that right now, trying to understand how what happens in those 9 months can impact a baby's whole life and the early findings. Pretty encouraging, actually.
Okay, so what are they saying? Well, some studies suggest that when a mother gets those iron infusions, her baby's born with better iron stores. And those stores stay better into early infancy, too.
So they're starting off ahead of the game.
Exactly. And you think about how much babies need iron for their brains to develop, for their cognitive function, for them to just grow properly. Getting that head start could be huge.
Makes you wonder what it means for those kids in the long run. Are researchers looking at that too?
Oh, absolutely. They're investigating whether that early iron advantage translates into things like, better cognitive performance, maybe fewer developmental delays, even a stronger immune system down the road. It's really fascinating stuff.
It is. It just shows you how closely connected a mother's health is to her baby's well-being. We also got a lot of questions about other ways to deal with iron deficiency during pregnancy, like are there alternatives to infusions?
Right. It's important to remember that infusions aren't usually the first choice. Most of the time, doctors start with oral iron supplements, the iron pills.
But the Malawi study showed those pills weren't as good as the infusions at raising iron levels. Why is that?
Well, a couple reasons. Some women get side effects from the pills. Nausea, constipation, upset stomach. It can make it hard to take them regularly.
So they might not be absorbing all the iron they're supposed to.
Exactly. Plus, how well your body absorbs iron from those tablets, it can depend on other things, like what you're eating and certain medical conditions. It's not the same for everybody.
Right. You got to find what works best for each person.
Exactly. And if someone has really severe iron deficiency, or if the pills just aren't cutting it, that's when those iron infusions can be a game changer.
Okay, last question. It's a big one, though. A lot of our listeners want to know what they can do to support better maternal health care, both here and around the world.
That's a question I'm passionate about. We can all do our part to make a difference.
So where do we start?
It starts with learning. The more we understand about the challenges pregnant women face, the better equipped we are to advocate for them.
Like they say, knowledge is power.
It really is. Talk to your friends and family about this. Support organizations that are working to improve maternal health. Even small things can make a big difference.
So spread the word and get involved.
Exactly. And don't underestimate your own voice. Contact your elected officials. Sign petitions. Get involved in events that support maternal health. Let your representatives know this is an issue you care about.
So use your voice and your actions to help create a world where every mom and every baby has the best possible start.
Couldn't have said it better myself. It's about recognizing that every woman deserves access to quality maternal health care. It's a basic human right.
Well said. And on that note, we've reached the end of our deep dive into iron infusions during pregnancy. I hope you're leaving feeling as informed and inspired as I am.
It's been a pleasure exploring this research with you all.
And remember, keep those questions coming. Stay curious. And let's all work towards a world where every pregnancy is healthy and every mother and baby thrives. Thanks for joining us.